often receive emails from people saying they've had their Achilles pain for more than a year, sometimes several years. Is there any chance of recovery? The answer is yes, absolutely. In this video, I'm going to explain what chronic Achilles tendonitis means with regards to the severity of your injury, what your chances of recovery are, what causes chronic Achilles tendonitis, and also what treatment we find works best. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for any type of Achilles injury, all done via video call. Have a look at the description of this video if you want a link to our website. In case you're wondering why some people call it Achilles tendinopathy versus Achilles tendonitis, well, Achilles tendinopathy is actually the correct term for ongoing Achilles pain. And the reason for this is that in medical jargon, any condition that ends on an itis type of name implies that there's inflammation or active inflammation as part of the injury process. Now, with Achilles injuries, there is a bit of inflammation involved during the early stages of tendon injury, and therefore Achilles tendonitis might be the right name for it during that stage. But during the later stages, especially if you've had it for a year or longer, there's no active inflammation really present in the tendon. And then tendinopathy is the more correct term because it's more to do with the structural changes that's happened in that tendon. However, I don't care what you call it. We refer with both names to the same thing. So in this video, I'm going to continue calling it Achilles tendonitis simply because most people call it that way. Does chronic Achilles tendonitis mean that you have a really severe injury? No. The intensity of your pain, as well as how long it's been there for, is not actually linked to the severity of your injury. It doesn't tell us anything about how severe the tissue damage is in there. Now, I realize this is counterintuitive, but let me explain. The first thing to realize is that any condition that's been present for more than 3 months is called chronic in medical terms. If it's less than 3 months, we call it either acute or subacute. So chronic in medicine is just the indication of how long the pain or the injury has been present for. But then also, with regards to actual tissue injury in there, we used to think that pain followed a perfect line with regards to injury. So if you have an injury, you have pain. The more severe your injury, the more severe your pain. And as your injury heals, the pain should decrease. But because we now have such good scans, ultrasound scans, MRI scans, CT scans, researchers have realized that actually this is not how it works. What they're seeing is that, yes, in some people, the pain is linked directly with the injury, and as the injury heals, the pain disappears. But in other people, they can have a severe looking injury on a scan and nearly no pain. And then also vice versa. They can have the injury has healed already when they look at the scan, but actually the person has really severe pain. So what's going on there? What we realize these days is that actually there's more things at play with regards to how pain is produced, and I will get to that in the last point as well. A good example of this is a recent research study that looked at 145 patients with Achilles tendonitis, and what the researchers were interested in was seeing how does the severity of pain link up with the severity of tissue damage they see on the scan, plus how badly influenced the function is of these people, so how they manage to do things day to day. And what they found was that the people who reported the worst pain as well as the worst function had very similar looking tendons than the people who reported the best function as well as the lowest pain. So to give you an example, the group with the worst pain was really not able to do much in the day-to-day life, and they were finding that their activities was getting really limited, versus the ones with the best function were able to continue running in other sports still. And what's interesting about this was they then went to look, well, does it matter how long they've had their Achilles tendonitis for? And they found that how long they had those symptoms for had no impact in the severity of the tissue damage or how bad their pain was. So what we can take from this research is just because your case of Achilles tendonitis is chronic, it doesn't mean it's a severe case, and it doesn't link up with how severe your pain will be that you're experiencing. Is chronic Achilles tendonitis permanent? No, it doesn't have to be. Even if your case shows a really severe injury on a scan, you can still make a recovery. Most of our patients, when they consult us, have had their pain for more than a year, sometimes several years, as you can see from the reviews I've posted here. Have a look at the description of this video. I've put links to the full reviews so you can read exactly what their situations were. Now, The treatment for chronic Achilles tendonitis is not complicated, but it does take a lot of patience and a lot of time. I will explain in a moment exactly how we approach treatment for chronic Achilles tendonitis. But first you must understand what causes chronic Achilles pain, because the treatment only really works if you can address the factors that's causing your specific case. There are three main causes that we've identified why people's pain often becomes chronic and the tendonitis just doesn't want to settle. Now, of course, some people will have just one of these, others will fall into all three categories, and none of them may apply to others. It all depends on your case. The first factor is that people are often doing too much rehab or too much other activity, or just the combination of everything is too much. When your tendon is injured, it doesn't have the capacity to cope with a lot of load and things, and not all of this is related to its strength. You can have a really strong tendon, but it may be really irritable, and if you load it too much, it just kicks off the pain sensors. So for your rehab to be effective, it must match your current strength, but also the irritability. And where the frustration often comes in is when somebody has a really strong tendon, they can do calf raises with loads of weights, but the tendon just remains painful. And in that case, actually reducing the calf raises and the weights may be the right option. So common things that people overdo is, one, they do their rehab exercises way too often. Tendons need at least 24 to 48 hours actually to recover from a strength training session. And if it's a really heavy strength training session, 72 is often better. So depending on the stage of your rehab or the level of weights and heavy strength training you're doing, we may vary the duration that either you do them daily if it's really easy, just circulation exercises, but if it's really heavy strength training, it's 2 to 3 times max a week. And you have to have recovery and you have to think about where you put that into your week with the other things you're doing. Then another common one is that people are doing exercises in positions that's just actually irritating the tendon. Common thing is if they have insertional pain, so either they have a bursitis as well or insertional Achilles tendonitis, or their tendon is just very sensitive to stretch and they do exercise over the side of a step or in a position that takes that calf and ankle into deep dorsiflexion. Or perhaps they're even doing calf stretches to help their Achilles because somebody's told them they've got to stretch their Achilles out. That is a common thing that we see that just keeps on irritating the tendon. It's a bit like pressing on a bruise. It doesn't really necessarily injure it further, but it just keeps irritating it. Using too heavy weights or actually ramping your weights up too quickly is another common one. And again, this is not necessarily linked to overpowering the tendon, that it's not strong enough for it. It may just be that you're doing it too quickly for the pain system to adapt to it. So you may have been given a target that you want to reach with a weight that if you can do this weight, you can start running. But it doesn't mean that you can just ramp up to that according to what your strength does. You have to do it in really small increments. Check how your tendon pain reacts in the 24 hours after that, and only if your tendon pain is reacting in the correct way, that it doesn't really flare up and it settles, it's just a bit of discomfort, so like a niggle, and settles down quickly, then you add more weight or more reps or whatever the case is. So often it's not just about ramping the weight up too heavy, but also how quickly you do that. And then also just the volume of things you do in a day or in a week. It's all cumulative for the Achilles. So for instance, your Achilles tendon works during your rehab exercises. It works whenever you're walking. It works harder if you're walking uphill or faster. It works when you're running. It works when you're jumping. All of those things combined. So if you do too many of those things in a day or too many of it in a week without proper recovery after them, that all accumulates to overwhelm your Achilles tendon. So often we may not even change a patient's regime heavily, except that we just add more recovery in there. So you really have to look at the whole program and see where the problems may be. The takeaway here is that yes, strength training is good, but it's not right for everybody, and your tendon can be strong, just super sensitive, and then actually strength training can make it feel worse, and you don't need strength training, you actually need rest. So every person's rehab plan has to look different because what works for one doesn't work for the other. If you're finding this information useful, remember to hit like and subscribe. The second common reason we see why people's pain isn't calming down is that actually they are protecting it too much and resting it too much and not doing enough rehab or exercise. So this is the other side of the spectrum. Now, the problem with this is that yes, rest is brilliant at calming your pain down, and it is something we often advise patients to do if they've got really irritable tendons, and then we slowly ease into activity. But often people will do the rest bit, it calms down, but they never ease back into activity, and that's a problem for two reasons. One is that sometimes your Achilles tendon may lose some strength when it's injured, and if you only rest it and you don't do much, it actually does less and less and it loses more strength. So now, where you used to be able to walk 3 kilometers before the pain starts, the pain will start at 2 kilometers or even just walking around the house because your tendon is losing some of its strength. So that's partly why it happens, but also there's good evidence from the research that if you overprotect an injury and start really avoiding doing things on it, it can dial up your pain system. It can cause it to cause more pain than what it should be causing. And I'm going to go into detail in this in the last point as well. So just the fact that you're actually overprotecting it, even if it's not losing strength, may mean that your pain system dials up. So what's the solution to this one? Well, it's a much better thing to do relative rest. So it means that you're not stopping all activities, or if you are stopping all activities, you're slowly figuring out which ones you can add in and then build on that. But yes, with relative rest, you can usually continue whatever you can do that doesn't irritate your tendon and doesn't cause a significant increase in pain for more than 24 hours. So you want to picture it at that niggle level, we always say. So this means that some people can continue running, others can continue walking. There's lots of things you can do, and it's useful to just try and figure out what's the best system to use relative rest for your pain. The third factor that we find influences chronic Achilles tendonitis pain is a dialed up pain system. Now, it's always difficult to talk about hypersensitivity in the pain system because people immediately think it doesn't apply to them. It doesn't have to be the full reason why your pain is there, but hear me out. If you've had pain for more than 3 months, this does apply to you to some extent. So this section may still be useful for you. So if you remember in the first section, I spoke about how research has shown us now that severity of pain and how long it continues for is not linked to the amount of tissue damage we have. So what's going on here? What researchers have now come to understand is that actually we don't have pain sensors in our tissues. We have sensors that tells you about things like chemicals, stretch, pressure, heat, cold, and they are sending signals to the brain. And it's the subconscious brain that has to decide at what point these signals is telling it that now it may become dangerous for your survival or to your body's health. And then it creates pain so that you can start taking an action to avoid the action you've been doing. However, it doesn't just use tissue damage to decide how dangerous or what the impact would be. What it does is it also looks at how severely it would affect other things that's important for your survival, like your finances, your social life, your family life, what it may mean for if you can't run again. All of those things impact how severe your pain is. But there's also a physical component to this. We've seen in the research that if you've had pain in an area for more than 3 months, the body actually becomes better at creating pain. So it creates more of those little sensors that sends messages to the brain. Those sensors fire off more quickly, and the messages are carrying more quickly, and the pain response is higher in reaction to them. So your body essentially becomes better at creating pain. So even though you may not have thoughts or feelings that's contributing to it, you have physical changes that's keeping this going. And that's why it's also important to apply the systems that we always explain about how you monitor your pain and adjust your rehab according to that, because it's the best way to actually calm the physical part of the chronic pain changes down as well. Other things that can dial the system up and make it more sensitive to pain or creating pain is chronic stress. So the stress hormones circulating in your body also triggers the pain reaction, and your brain can't tell if it is work stress causing the stress hormones or whether it's injury linked that's causing that. So whenever you've got heightened stress, especially over a long period, that can actually increase your pain. It's worth also understanding that this is not your conscious brain we're talking about. This is your subconscious brain. And the subconscious is really distrustful of the conscious mind. And this is why mind over matter doesn't work. If you just try to push through your pain and ignore it, the subconscious is shouting out more, hey, I want you to protect us, and it's increasing your pain. So that's another factor of why this pain system can actually become hypersensitized, is if you keep on trying to push through the pain. We've actually made several videos on the topic of chronic pain and techniques you can use to help calm it down. I'll link to those in the description of this video. But the good news is that you can calm a hypersensitized nervous system back down through a program with careful load management, so you're not just trying to push through the pain, plus working on any thoughts or feelings or beliefs you may have that could be dialing this pain system up. Now, sometimes some simple techniques like positive self-talk is enough, but other times consulting a sports psychologist or pain psychologist can be really useful. We have had really good success helping people with chronic Achilles tendonitis recover, but this doesn't mean we use any special techniques or amazing exercises. In fact, I think our plans look quite simple, but this also doesn't mean that we're using a one-size-fits-all approach. I really believe that we're getting the success we're getting because of two things. One is we're really taking the time to understand the full situation that applies to the patient. So not just their Achilles injury or the scans they've got or the pain they have, but how everything in their life feeds into this and may affect it. And then second, we do stay on top of the latest research so that we ensure whenever we look at a patient, we're doing that through an evidence-based lens. So what a person can expect when they consult us via video call is that first, they're going to have a really in-depth conversation because we need to understand all the factors that apply here. We'll also perhaps get them to do some test movements if that's appropriate, so we can test the capacity of the tendon. It really just depends on the situation. Then we'll create a starter plan. Now, this starter plan may include things like adjusting their shoes, adjusting their daily activities, rehab exercises. Sometimes it doesn't include rehab exercises because it's not the right thing at that moment and we first need to do other things. So it can be a variety of things. But they then have to go away and test how this plan affects their tendon over the next couple of weeks. Why wait 2 weeks to tell us how it affects it? Because the effect is often cumulative and we need a period of time to see what the cumulative effect is of the plan. We then get them to come back for a follow-up consultation. So again, we can have that in-depth conversation and really understand all the factors that played a role in the couple of weeks that we haven't seen them. And then we'll build on the previous plan and adjust the one we gave them. So it's not something that we can immediately say, this is the whole plan you're going to do. And it doesn't always include rehab. And it sometimes can look like a really simple plan. But if that's what's needed to calm the tendon down, that's what's needed. We may also refer the person to see a pain psychologist or sports psychologist if we feel that actually they can really benefit from that part, but it really depends on the person. The take-home message here is that you don't need any special treatments to get rid of chronic Achilles tendonitis. It's treated in exactly the same way as an acute case should be treated. And I've made videos in the past about the best evidence-based treatments and rehab for Achilles tendonitis. So have a look at the description of this video. I've added links there. Now, let me know in the comments if you've got any questions. If you need more help with an injury, you're welcome to consult us via video call. Link is also in the description. And if you found this video useful, please remember to hit like and subscribe. Take care.